Hi, I am Dr. Khurrum Shaukat Yusafzai. Man always wanted to travel around the world. And first he did that in the ships, then came the airships. The airships was invention of the German, and Hugo Ackner, the great aviator of Germany, with his Graf Zeppelin airship, he circumnavigated the globe in just 21 days. That was a marvelous feat and a world record in 1929 August. He traveled all over the world, over all the continents, Africa, Asia, Europe, everywhere he went, and even to the Americas. Just few years later, Willie Hardman Post, who set the world record by traveling in his Lockheed Vega 5B Vinime aircraft along with his navigator by the name of Harold Getty. He went around the world in 1931, and he was the one who actually discovered the jet lag. He described some symptoms that happened when he traveled in the aeroplane and he crossed the time zones. And now this phenomena is known by all the pilots and all the cabin crew all over the world because they do it every day, and the global travel has become very common. These aviators know the symptoms of jet lag. They have severe fatigue, they have body aches, they have digestive abnormalities like diarrhea or constipation, and they have psychological problems as well. This jet lag is a bit similar to the night shifter phenomena. The people who are awake at night and they perform their duties at night, like the nurses and the doctors. They are also having severe fatigue, body aches, and also they have digestive problems and also insomnia, sleep disorders and psychological problems, just like the jet lag people. So why the night shifters and the jet lag people suffer a similar fate? This is because of the circadian rhythm. So what is actually a circadian rhythm? Circadian rhythm is actually the biological clock found inside the human body. This clock tells you to sleep at night and work in the day. So it depends on the light. Like when the sun sets, we are programmed to sleep, and we should sleep and we should wake up early, and then we should complete a cycle of sleep, like at least 8 to 10 hours of sleep is necessary for the human body. But during that sleep time you are working, it causes the night shift fatigue, and the travel and the jet lag are also caused because of the same reason, although it's not similar, but the basic cause is similar. Like in the jet lag, you cross the time zones. In the travel fatigue, you just don't cross a time zone, but you travel. Circadian rhythms are important for conversion of lot of body functions, and the Zittgebers, which are the light, meals, exercise, social interactions, and daily routines and stress, they are very important. How to recognize circadian rhythm mismatches through the Liverpool questionnaire, and these are some of the signs and symptoms which you can experience. It can cause chronic medical conditions and health problems, and accidents can happen, and long-term sleep loss can happen that can cause really big psychological and cognitive problems. The brain won't be functioning, the concentration is lost, emotional and social difficulties come. So jet lag really happens when you cross the time zone, and especially if you travel east to west axis. If you travel north to south, it's not that great. Travel fatigue occurs even if you're not crossing the time zones, but the symptoms are same like the jet lag. Night shift fatigue is also like the travel fatigue, but you can fix it. How you fix it? Because it causes six type of sleep disorders. I have put all the six types of sleep disorders here so you can recognize it. The research articles which I have consulted, they actually describe whatever I told you. And how to fix this circadian rhythm, the normal medical practitioners, when you approach them, they will give you some medicines. So I will show you what medicines they give you. And these medicines actually have side effects. So if you take them like sedatives, and there is melatonin, like the hormone which is in the pineal gland, and also they give you caffeine and some other sleep inducing drugs. They can have another all the complications which maybe some people would not want. So in order for such people, in order to reset the circadian clock, there are other methods as well, like the hyperbaric treatment. In the hyperbaric treatment, there is no use of drug, and you can reset your circadian rhythm. The new research in this field has shown that it is actually the hypoxia, or the lack of oxygen, which can reset your circadian rhythm. And how you can do that? Through hyperbaric medicine, because it increases the HIF in the body, and increasing the HIF in the body, a lot of beneficial effects occurs, including resetting of the biological clock. And when the biological clock is reset, it is synchronized with the other with the actual time when you have finished your flight, or when you finished your work. So these are actually the medicines for circadian clock reset, like melatonin and some drugs, caffeine, etc. Now, how to do that through hyperbaric medicine? When you have access to the hyperbaric chamber, you can have a soft home-based chamber for your home use. If you are a frequent flyer, I suppose you should buy a hyperbaric chamber. I can help you in that. Or you should go to a hyperbaric center, take the treatment over there. And by just taking actually 2 sessions, you can actually reset your biological clock. It increases healing by 300%, increases the stem cells, decreases edema, and improves your overall body function. How this HIF factor was discovered was by a brilliant doctor, Dr. Gad Ashur, a clinician assistant professor at Weizmann Institute of Science in Rahwat near Jerusalem. Near Tel Aviv. And he was the one who actually discovered the role of HIF-1 alpha, which actually resets the biological clock or the circadian rhythm. So because of his brilliant research and the hyperbaric medicine, we can cure it. I hope you enjoyed my video. I want you to like my video and also subscribe to my channel for such informative videos about hyperbaric medicine, which is very rare, and I'm one of the very few doctors in the world who is trying to explain about hyperbaric medicine, which is completely new. So I hope you subscribe to my channel. Take care. Goodbye. See you soon.